Washington, D.C.'s local mask mandate has finally been lifted. It was one of the strictest mandates in the nation, starting in the summer when the Delta variant made COVID cases spike again.
We're shifting the government's response to providing you this risk-based information.
As cities and states around the country weigh their own mandates, we're going to have a choice to make, to wear or not to wear a mask. And if I'm being honest, that's a lot of freedom I'm not sure I'm ready for. So I asked some experts for advice.
It would be, I think, premature to lift those mandates at this point, right before we hit the winter surge. I think it's a mistake.
Winters are already hard on hospital systems, and while vaccines have proven to keep most people out of hospitals, some experts aren't sure how effective they are at keeping you from giving the virus to someone else.
People who have been immunized, the immunity wanes over time. There's a little bit of a lag time from the time you get the virus hits your nose to the time your immune system recognizes and reacts to it. You have an immune system in place, and so it's going to prevent the virus from giving you bad pneumonia or putting you in the hospital, but you are probably still going to be able to infect those around you.
And the problem with transmitting the virus not only means putting vulnerable people at risk, but that the more the virus is replicated, the more likely it can turn into another variant none of the vaccines can protect us from. But Monica Gandhi, a believer in the power of masks, also believes that higher numbers of vaccinated people means that it makes sense to rethink when masks are necessary.
Masks work, but they're not profoundly effective, especially on a population level. And they're important for the individual because they could protect the individual, which is why I would protect elderly and immunocompromised inside. But they're nowhere near effective as vaccinations, which right now, at least in terms of preventing severe disease, are upwards of 90% protective. If you're a fully vaccinated individual and you feel well, you taking off your mask in front of others, especially who are fully vaccinated, you are not rampantly spreading infection like we used to be concerned about prior to vaccination.
Getting rid of mask mandates can also be used as an incentive to those who are hesitant to get the vaccine.
You know, I am an HIV doctor at heart, and messaging and positive motivation has always been a part of our ethos. We need to use anything that we can to motivate vaccinations, including life goes back to normal, including you don't need to wear a mask.
It's a lot to consider and can be overwhelming. If it helps, according to the CDC, if you are fully vaccinated, it still recommends that you wear a mask indoors in public if you are in an area of high transmission. DC is still considered a place of high transmission, but there are fewer hospitalizations. It's also still recommended for unvaccinated people, those with compromised immune systems or underlying medical conditions, to continue to wear masks. Keep in mind that, at least in DC, businesses are still allowed to require masks if they want to, and that local regulations will still require masks in some settings like buses, government buildings, and public schools. The rest is up to you.